Hello and welcome anyone who's joining us live today at 11 a.m. GMT. But if you're watching the replay, fabulous to have you here too. I am Sheren Gaulbert. I am a pain therapist. I work with trauma informed approaches and trauma release approaches and cognitive hypnotherapy. And I'm also a clinician coach. And I'm here with the wonderful Laura Rathbone. Introduce yourself.
Hi, thanks very much for the invitation. My name is Laura Rathbone. I'm a pain specialised psychologically informed physiotherapist. And I'm here in the Netherlands, in Amsterdam, where I work as a physiotherapist under license. But I'm from the UK and did all of my training in the UK and spent most of my career down in London, which was wonderful. I work with people who have particularly complex experiences of pain alongside psychological disorders and trauma, much like you, Sheren. So we have a shared population. And I'm also a clinician coach. So I work with multidisciplinary clinicians and therapists who are specializing in pain or are specialized in pain and need extra support and supervision and guidance and coaching and mentorship all in one, and therapy sometimes all in one. Yeah.
And we've got a lot in common, haven't we? I mean, you started with the physio side of things, and I'm sort of more top down, but
Yeah.
we're interested in similar things. And of course, our patient group is similar in terms of they tend to present with persistent pain, and we also guide clinicians as well. If you're watching live, do say hi. Hi, Tarek. Thank you for joining us. Do say hi if you're watching live and you've made it at 11 a.m. GMT, and say hi and comment if you are watching the replay as well. We're here to just sort of talk about reflective practice and the importance of reflective practice for clinicians. And, broadly speaking, with reflective practice, we can use it in different ways. It's the idea that we reflect back upon a period of time, whether that's a week or a month, and look at perhaps our wins, things that we've learned and picked up, and things we want to do differently. And I'm interested to see, because we were posting about this around about the same time. We had a chat about this last year as well, didn't we, Laura?
Mm.
And I'm curious as to how you utilize reflective practice, and also perhaps an aha moment that came as a result of your reflective practice.
Yeah, so I've had a bit of a journey with reflective practice, I think, over the years. And in physiotherapy, reflective practice is like it's a culturally relevant thing. We talk about it a lot, but it's not necessarily, I don't know what the word is, but it's not necessarily like supervision is not required. It's a kind of an optional thing. And so by extension of that, reflection can sometimes slip away and it can sometimes go under the radar, or you can think, oh, I'll do it next week, or I'll do it another time, or I should reflect on that, but might not necessarily get there. So part of the process for me was just bringing it into my regular practice. And I mean, personally, I have a reflective moment after every patient. And then if something particularly big happens, I will do a more detailed reflection on trying to figure out, where did that go wrong, and also where did I do well? Because just because something went wrong or didn't go quite the way you wanted it to in clinic doesn't necessarily mean you've done anything wrong or you could have done anything differently. And so sometimes it's about reassuring myself that, I'm still practicing within my moral code. I'm still holding my own ethics. I did the best I could. If this were to come up differently, maybe I would try and do this differently, or something like that. So I use it more to sort of support myself and to give and also, it's also a way of noticing if I'm bringing anything to the clinic. So before I even walk into the clinic, is there something that I'm bringing in, like irritability, or have I got a lot on my mind? Did I sleep well? Am I unwell? Am I a bit under the weather, like I have
Mhm.
been recently? And just noticing I can't be, I might have to make necessary and reasonable adjustments in order to protect my patients, to keep them, to make sure I hold a safe space for them, but also to make sure that I'm protecting myself, and holding a safe space for me during all of
Yeah.
that. So I guess reflection has become, it's gone from being this thing that I, culturally was sort of, it was there in the background, to becoming a really essential part of how I build my clinic list in the future, how
Mm.
I design my practice, how I walk into the clinic, how I close off each patient session, and how I manage difficulty and struggle. So it's become a really big part of how I
Mm.
operate. Yeah.
I think it's just starting with one thing, isn't it? Because I think the way we incorporate it, as you say, after a session, and there's a lot to it, and it might be for people listening in thinking, oh, that's a lot to do and hold right there. And I hear in there compassion.
Mm,
It's okay if this didn't go as well as I intended it to go. And what am I bringing to it? So we're touching on potentially, yes, how's my day been? What else is going on through my mind? Um, and also, I'm quite specific with, I use reflective practice in all sorts of ways. And as when I was trained as a cognitive hypnotherapist, we have regular supervision, right? That is just something that is, it's written. We do that. And you are a member of a peer support group after 3 years. If you're not in regular supervision, say monthly, and that is the stipulation, monthly, then you are part of a peer support group. And every year we've got to declare that.
yeah.
So I've heard this before from other professions where they don't have supervision. And I think, oh my goodness, how are
Mm,
you reflecting on that, and also being able to hear the opinions of your peers and someone who is objective,
yeah.
looking in at that situation? I've learnt so much from supervision and the peer group that I have been running since I think 2012. And we meet monthly, and it's
Yeah.
huge because someone else will have a different perspective, and it's just, oh wow, I didn't see it that way. We
Yeah.
all bring different, don't we? And the way that I've been using it more recently with my clinician groups is around, I'm really into embodied cognition, right? How the embodied experience
Who
of pain. I'm
isn't?
into it, right? Really into it. But I want to bring one element of embodied cognition in, and this interoceptive awareness,
Yeah.
what is going on in our body. When we're in an interaction, we can reflect upon it afterwards. So that can be an emotional response, or there might be a tension or something. And I certainly have huge awarenesses by tuning into that. And because of the reflective practice after the fact, I'm picking up things like, oh, my jaw was clenched whilst
Mhm.
she was saying this.
Yeah.
What was going on internally for me? What was I connecting this to for me? Because this is about me. It's not
Mhm.
about the patient. If I'm gripping my jaw, what meaning have I put on that?
Yeah.
What biases have I brought into that situation? You know, what was I doing in that moment?
Mhm.
How make that about me? So because I do that naturally as part of reflective practice, you recognize it then
Mhm.
when you're in the clinic, where
Yep.
you suddenly think, "Oh, hold on a second." And
That heart
and
rate
they
going up, I'm starting to feel sweaty, things are starting to feel tighter, heavier, I mean, interoception is such a great barometer. I mean, it's not necessarily great in terms of giving us meaning. So
mhm,
interoception is the awareness of the internal sort of bodily state. So thinking it's things like heart rate, whether your mouth is dry, whether whether you're feeling like your breath is starting to get shallower, or if you're starting to feel warmer, sweatier, these kind of messages and subtle shifting in internal sort of physiological system, I
yeah,
guess,
yeah,
that can have multiple meanings, right? So it doesn't necessarily tell us what it means. Um, but in the context, if you're starting to feel a bit stressed, then that might start to feel like an anxiety message that's coming through, and you might start to notice that, and being able to just be aware of, "Oh, okay, my heart rate's going up. I can hear my heart rate, or I can feel my heart rate," and just give it a label and know what it is, and then be able to, um, choose how you respond to it, can be a really powerful in the moment reflective practice, I think.
Yeah.
Yeah.
And that's in the moment, because we don't want to get carried away by working out what's going on and suddenly, having an internal focus rather than an external focus on
Yeah.
the patients in front of us. So Laura, can you share one thing perhaps from your week or your month, where you've used reflective practice and it's given you a real sort of aha moment?
Oh, I mean, this past month I've not been particularly clinical, and that's partly because I haven't been very well. And so being able to reflect on that and say, okay, I'm not going to be able to take these patient sessions. I mean, that just in and of itself has been oh, I apologize. That's our doorbell. Life happens. um, I mean, this week, one of the hardest things for me has been just reflecting on how not well I've been. I don't know whether that's relevant, but it's certainly been relevant for me this week. And being able to say, no, I'm not able to take these sessions. I do need to close down my lists. I can do this, but I can't do that.
Mm,
Um, and every time I go through that process, I do feel like it helps me grow more into this mature clinician that's able to put the needs of my patients first, even when it makes me feel uncomfortable. And even if it feels hard, because saying to somebody, actually, I'm going to cancel your appointment is quite a scary thing to do. So that has been a very helpful process for me just this month. And it's always interesting when patients say, "Oh yeah, absolutely, of course you're sick," and they're quite glad that you've not brought them in to see you whilst you're ill. But your feelings, like my feelings and my self-judgment and my feeling of guilt, like I shouldn't be ill, I should be able to do this. I should, I don't want to let people down. I don't want to, people are going to miss out somehow, or what, um, that's all the stuff that comes in between being able to make a good decision, isn't it?
mm,
So yeah, so I guess that's how I've particularly used it.
mm,
This, I mean, even 3 days ago, I was having to go through this process of, well, how am I today? Where is my energy levels? How am I in managing conversations and complex stuff? Am I going to be able to listen deeply and
mm,
respectfully in a way that is needed by this person who has had a shocking journey through the healthcare system? And my goal is to not be another step in a shocking journey.
yeah.
So it's I suppose for me it's been a particularly reflective week, um, that has resulted in me actually having to put, you know, be less clinical, which has been incredibly difficult. Yeah.
Yeah. And I know you love what you do, so that's a tough decision to make. And yet it's absolutely the right decision to make, isn't it? And reflective practice, it spans everything, doesn't it? It spans our life,
Mm.
um, our skills for life in a
Yeah.
way. We're
Yeah.
applying to the clinical setting and recognizing when you're not well. And thank you for doing this, because I know you're still recovering. And we postponed this from last week because you were really under the weather, and I respect that, because I'm always talking about healthy boundaries and clinicians
Yeah.
not burnt out, and it's staying within our means and what is okay for us to do in that moment. That is so important. So I'm glad we postponed and you were able to say, right, no, I need to rest.
Yeah.
Absolutely.
Yeah.
And to hear that you've seen one patient today and then you're going to be resting again. Wonderful. Right? We're walking the talk is so important. And that shows up, I think, when we are treating patients. They kind of recognize that somehow, that we're
Yeah.
walking. I think that's really important. Now, I've got to pick you up on something, because you said put the patient first. I'm really hoping that you are putting yourself first with compassion, and you're bringing that compassion to yourself, and therefore you're recognizing, actually, because I'm not okay, I'm not going to be able to serve my patients, because I think it does have to start with us first.
Mm.
We can
Yeah.
then honor our patients. I'm hoping that's what you meant, Laura.
Well, now I've said it, now you've pulled me up on it. I have to think about it. I think putting the patient first is probably a way of me oh, yes, I think both needs to come first. So I can't help my patients if I'm in a state, if I'm and, I talk about this with my clinicians as well that I work with, if you've just been in a session with someone that has and the content of that session and the way it's been drawn out, the way it's manifested, the way it's happened has come very close to something of your own pain. You probably need some time to deal with that before you go into your next session. Um, and a clinician recently reflected, and it's something I've experienced as well. So I can also just talk from my own experience. But you're going to take that 10 minutes anyway, whether you take it 10 minutes into the session with your next patient, because it's going to take you 10 minutes to calm down anyway. It's going to take you time to get yourself ready. It's going to take you time to listen. And you might already have the patient through the door. So you're going to take that 10 minutes anyway. Or you can choose to delay the start of that next session so that you can go and have those 10 minutes by yourself in a respectful way and not allow it to seep into what is the protected time of that other person who's come to see you in healthcare. And I do think that that is what it is. It is a protected time for them to come in to talk to us about their healthcare. If I haven't recovered from the session beforehand, I'm going to bleed that recovery in to their protected time. And for me, that feels unfair, because if I was going into a healthcare session, I would want somebody to be 100% or as present as possible as they are able to be with me. And I would rather they took 5 minutes to get themselves, have a cup of tea, settle themselves down, scribble a few notes down, do a practice, whatever it is they need, so that they can come in and we can have a more successful therapeutic opportunity here. And so we sometimes get into this situation where we feel like we have to run straight into the next session. And we sort of kid ourselves into thinking that those 10 minutes that we take in the beginning, we can kind of cover it up or we can hide it from the person in front of us. But what we're actually doing is starting that therapeutic relationship in an inauthentic way. And that is, I think, can speak volumes to the other person in the room. So, it's okay for us to disrupt the system, disrupt the rhythm sometimes in order to prioritize our need for reflection so that we can prioritize the person when they're in their protected time for their therapy. So I guess that's what I mean when I say put the patient first. I don't mean above all else. Like it it's a dynamic relationship. There needs to be space for us both to turn up in that sort of Carl Rogers way, where we both turn up authentically, we turn up motivated on the same problem to help the person who's coming in need of service or therapy, however you label it. And if I'm not able to do that, then I should have the maturity and the honesty to just step back and take the minutes that I need. And that, I think, is my kind of social contract with the patients that I work with or the clients that I work with, be that a clinician or a patient.
Oh, it's far more respectful, isn't it? It's a
Yeah.
respectful therapeutic alliance there. And yes, if we are running a bit late or actually we just need a breather beforehand,
Yeah.
the patient is going to be better served by us taking that time and us just saying, give me 2 minutes or give me 5 minutes. So you can be truly present, present as possible, as you say, with that
Yeah.
patient.
Yeah.
Um, Do you ever do your reflective practice as a written exercise, or is it always a kind of a thought?
No, it's often written. So I have a section in my notes where I ask myself the same question every time. And I wrote it down because I thought I'd share it if that's okay.
Yes, please.
So I put, what does this situation bring up in me? Is the first
Yeah.
question at the end of each session. And then what skills do I have to help myself navigate that?
Yeah.
And I do that, and it might be that there is nothing really brought up in me, and there's nothing that it might be that I can leave that relatively empty, but sometimes I need it, and, so that will be written, and then I do have, like, a reflection journal that I write, but I wouldn't say I did that every day. Often
Yeah.
it's just a sort of a thinking process where I might,
Yeah.
just spend some time just being like, "Wow, that was a big story,"
Yeah.
and just allow, especially when you work in trauma, you know,
Mm.
you're hearing sometimes quite, moving,
Mm.
um, experiences about a person's life, and I think you do need to just sometimes sit down and just let that settle into your system a bit. Yeah. So
Mm.
both.
Yeah. Yeah. And actually, that question is similar to I do have a structured reflective practice for people to download when they watch afterwards. And actually, I'll pop it. I think I've got a should be able to show it on screen whilst we're in there as well. Let's have a look if this works.
Oh, it's
Not really.
exciting. Oh.
Ah, it's behind there. I'll show it at the end.
Oh, Sharon, you you have this ability to take a very complex, difficult to do thing like reflection and find a way to structure and guide somebody through it so that they can move through that process. I guess safely is a nice way to think about it. And I think that's amazing. Like, it's a difficult thing to do. I use Gibbs mostly because that's what I've always used. But like, I think it's really great to be able to give people that kind of a structure.
Mm.
So I would definitely be downloading it.
I'm going to share the link in the comments, and then people can have a look at it. Stay with us though. You can download it afterwards. Um, just seeing. For some reason, I can't see LinkedIn. So, I can't post comments to some destinations. So, if you're watching on LinkedIn, I will post up the link afterwards. But I do go through a process because I think what I was trying to do is, right, what is the process I take myself through? And what is there's a very traditional reflective
Yeah,
practitioner exercise for therapists that, I started out using, and I've modified that to cover a few things. And I think
yeah,
celebrating wins is a lovely starting point if we're reflecting back on the week or the month. What went well this
yeah,
week, and what was it about me in that interaction that
yeah,
made that go well? So we're kind of appreciating that we had a part to play in something going well, whether that was an interaction or something that was achieved. And then we go to what didn't quite go well. What could have gone better? Was there an interaction that wasn't so easy, that was perhaps a little bit challenging? And
mm,
then looking at kind of responses and emotions that came up and actually kind of jotting those down. So you're kind of honoring that that happened in that moment. Otherwise, it can just happen and hijack us over and over again.
yeah,
So it's kind of recognizing that it's happening, and then looking at, what might have influenced that reflection. So you're not going to do this in the session because you're going to be with the patient. You might just recognize it in the moment. And using a reflective practice, a structured reflective practice, can mean you're more aware of reactions and responses like this in the
yeah,
session. So you can just shift that and be with the patient again. Otherwise, we're slightly hijacked without realizing. Um, and then kind of looking at, right, was there something that colored my judgment?
mm,
The One of my big aha moments, and we will wrap up very shortly, um, was Oh, years and years ago, and I took this to supervision and I did a reflective practice on it. And
Mm.
the wonderful thing about supervision is you do the sort of reflective practice, then you go to supervision. You've already had a bit of an aha moment, then you have more of an
Yeah,
aha moment in
yeah,
supervision or peer support. And I knew that I was really frustrated with something a patient was telling me about her partner. The patient was lovely. I thought the partner was awful, right? I'd made a judgment, regardless of the fact that she was telling me he was supportive. And what I'd done was I'd not allowed her to just have her experience. We may not condone other people's behaviors and what kind of
mhm,
relationships they're in, but that's our bias and our preferences. And sometimes we just sort of have to allow people to grow and discover things themselves. And also, that may not be a biggie for them.
right,
And I was kind of getting, every time I saw her, I would have this sort of, I'm seeing her again, so I'm going to be hearing about the partner again, that sort of thing. And it was draining, right?
yeah,
Since then, I talk about kind of having a sense of our own boundaries and our own space. So we're not taking that in. We're holding that space for them. We have our own space. They have their space. We have no right to go into their space or pull their stuff
yeah,
into our space. So kind of just sitting with and recognizing that's going on. And then, as you say, what other factors are at play? What lessons, have I learned? And importantly, what is the growth point here? And do I need support in this? Do I need to go and speak to a supervisor? Do I need to speak to a clinician coach or join a peer group? Um, there's the opportunity for growth here. And I think that is essentially what reflective practice is about.
yeah,
Growth, development, that ensuring that we're not staying still and thinking, listen, I saw you post something about imposter syndrome, and I had that big time this week. I sat in the session thinking, God, I'm just rubbish at this, and then thought,
yeah,
hold on, it's not. Hold on, and by the end of it, I'm like, oh no, I'm pretty good at this actually. I mean, it was
yeah,
not about me at any point, but I was really tired this week due to stuff that had happened outside of my control,
yeah,
outside of work, and that tiredness had crept into the session and had suddenly
right.
made me go, "Oh, I'm rubbish. It's not about me."
Yeah, but it's no surprise, is it, that you feel more vulnerable? You know, that the narrative of vulnerability, the feeling of vulnerability, the sort of like how you move around the world in a vulnerable way. Like when you're tired, when you're sleep deprived, of course that's how we feel. We're human. And I think the thing that reflective practice has brought me so much closer to is this, like, my own humanity. It's like, it's okay to be human and to be flawed and to not be perfect and to be unpredictable and to have stuff happen. And because it's okay for me, it's okay for the people I work with. And, there was this aha moment, I guess, where I was like, okay, I'm no longer going to charge missed appointment fees or late fees. It's just because life sometimes happens, and this is a choice I make, because I want to feel like if I need to cancel last minute, I can. And so it was a sort of like a kind of a reflective practice. It was a moment where I was like, this is what it is to work with humans, and this is how I'm going to design my practice around that reflection and that doesn't mean everybody else needs to do that. It's just what I do. And it's making space for the human in us, and the fact that being human is impossibly complex. It's impossible to predict all the time. We can't control it, we can't tame it. It just is what it is sometimes. And these are the things that I have found the more I reflect, the closer to my own humanity I get, which means that I'm more able to see the humanity in other people. Um, and I think this is the real power of reflection. On the one hand, you say we're creating these boundaries. This is my stuff, that's your stuff. And it sounds like we're almost creating a distance. Um, but actually, those boundaries allow us, I think, to get much closer to each other, in a really sort of paradoxical way, maybe. Um, because what we're saying is, okay, you know, I know myself really well now, and I'm getting to know myself better all the time, and that's exciting and changing my practice every day.
Mm.
And because I know myself really well, there is enough space for you to start figuring out yourself around me.
Yeah,
And I think that's what
absolutely.
reflection can give us. Yeah.
Yeah. And I think that's a nice point to wrap up on, that we're all human. You know, you're
Yeah.
human. We're human as clinicians. That patient in front of us is a unique human with their own experiences and whatever else has been going
Yeah.
on in their life in that moment.
You know, sometimes stuff happens, and sometimes it's unplanned, and sometimes you get into the room together and you're like, "This is just not going very well." You know, we don't, you know, what's going on? And then you find out that actually this person hasn't slept all night, and they were late and they were rushing, and this just is not the opportune moment for us to do therapy.
Mm.
And you know, that sometimes is okay.
Yeah.
And it's, you know, being particularly within the relentless physio model, which is this like turning door, high volume clinic,
Yeah.
you know, one in, one out, one in, one out, one in, one out, one in, one out, where we're not in the culture of dealing with emotions and feelings. We're in the culture of dealing with tissues and body parts, which don't need time to talk because the, you know, that's how we're taught. But, you know, attached to all of those are you know, rich, complex individuals who have had a journey just to get here. Um, and if we start dismantling that culture and rebuilding a new culture where, you know, people are allowed to be human, what can we do with physiotherapy in the future? And how can it serve the people who come into our clinics in a more kind and compassionate and embodied way? That's what I'm interested in. And I think
Yeah.
reflective practice is a big part of that.
Absolutely that. Yeah. Yes, and yes to that little breather in between sessions as well. So important, right?
And
Just moments. Absolutely. So, listen, thank you for those of us who joined us live, and any of you watching on the replay. You'll find the replay on YouTube and LinkedIn. So, you know, go to your location of choice. And I will put the links up as well. And as we finish, we're going to come off screen and you will have an end screen where there's a QR code for you to go and um, grab that free resource. So you have a structured reflective practice that you can just use, you know, weekly, monthly, however you wish, to just kind of actually grow and develop. So thank you so much. Thank you so much, Laura.
thank you for the invitation. Anytime.
Because Laura, you hang out on Instagram and LinkedIn mostly, right? So
Yeah.
Instagram is good.
Instagram, Laura.𝗺specialist, and LinkedIn and Twitter. And you can also just find more information on my website, laurarathbone.com, and our reading community, paingeeks.community as well.
Yes. Brilliant. And you can find me on LinkedIn as my name, Sheren Gaulbert, and on Instagram, sheren.health, and my website is sheren.health. So yeah, check us both out and we will both see you soon. And on the end screen, there will be the opportunity to download your free structured reflective practice. Cheerio for now. Bye.
Bye.